Hi, I'm Abby Dueck. I'm a physical therapist for Run Raleigh PT, and I want to go over foam rolling a little bit more in detail than what you may have seen before. So the first thing I want to start with is working the glute complex, an area that gets very tight in runners. So you line up your foam roll so you can sit on it. You keep one leg bent and you take your other ankle and cross it onto the opposite knee. The leg that's crossed is the leg you're going to be rolling. So you lean just slightly onto that glute. And you roll your glute in about 3 segments. Start close to the middle and gradually working your way out, holding each one for about 30 seconds. So it'll take you about a minute and a half to work all the way out to your outer glute. And you want to make sure you lean pretty far to the side in order to get that junction. And so once you've rolled your glute, you straighten the leg, turn onto your side, and you want to roll in between the top of your pelvis and your outer hip bone on your leg. So you lift your leg up, and it's only about 6 inches, and you roll straight down the middle. And then you want to get the junction between the TFL and your glutes. So you turn slightly back, and you roll right along that junction. You're going to hear me use that word a lot. It's an area that runners miss on their foam roll. And this area is really responsible for a lot of the IT band issues that runners get down towards the knee. So it takes about 5 segments to work your entire glute complex. So after you've rolled there, you're going to push your foam roll down towards the hamstrings. You can bend one leg up, put all your weight onto the opposite hamstring, and you want to, again, roll this inner outer to get the junctions of the hamstring. So I'm going to turn my body to the side, work the outer hamstring, again for about 30 seconds, and then turn and roll the inner hamstring. If you don't feel like you're getting a lot of release there, you can take your opposite leg, stack it on top, and again, work inner and outer. And of course, you're going to do everything on both sides. Then you push it down towards your calf, and you want to work the muscle bellies of the calf. So you want to get that outer calf and the inner calf, just like you did your hamstring. So you lift yourself up, roll your foot out, get the outer calf, and then roll in and get the inner calf. Again, if you don't have enough body weight on there, you can stack your legs, hold your stomach muscles nice and tight so you don't strain your back, work inner calf and outer calf. You don't need to go down to your Achilles. You can just stay up in the muscle bellies. So after you've done that, you can flip over to roll your quads. So you get down in plank position, foam roll underneath your thighs. Again, stomach muscles engaged so you don't strain your back. For your quads, you can go straight down the middle. There's usually a lot of restriction there. And then after you've gone down the middle, you can turn your body again to get the junctions. So on that outer quad, getting my junction with the IT band, and then turning and getting the inner quad, the junction with your adductor. And again, 30 seconds or so in each position. Now, a lot of runners stay very tight up in the hip flexors. So you want to use your foam roll and get it right inside the front of your hip. So I'm going to line the edge of the foam roll right on the inside of my hip bone. Then once I'm down again in plank position with the foam roll in place, I'm going to drop my opposite hip so that the foam roll is not on the bone but on the inside of the bone to roll the hip flexor. And it goes up into your abdomen, so you have to go up around belly button height and back down. Another tight area for runners that we don't always get is the adductor, your inner thigh. So you want to lay down next to your foam roll, put one leg up, and roll the inside. You shift your weight onto the foam roll and roll the inner thigh up towards your pelvis to release that muscle. And that is foam rolling for runners.